HPV is a virus. It's a germ. You and I, we have germs in our body that actually makes us healthy. But there are certain types of germs that are bad. Hello, my name is Dr. Omolola Salako. I'm a consultant clinical oncologist. I'm the founder of Shebekli Cancer Care, Oncopathy Technologies, and Pearl Oncology Specialist Hospital. I'm fondly called the People's Oncologist. Today, I'm live on BellaNaija, and we're talking everything HPV, cervical cancer, and everything in between.
Hi, Dr. Salako. Wow, so you've been a force in the fight against cancer in Nigeria. Tell us about your journey and motivation.
My journey into cancer is very purposeful. I started about 23 years ago when I lost my younger sister to kidney cancer. She was 18 years old at the time, diagnosed with kidney cancer, and within 3 months she passed on. And kidney cancer and certain cancers are not preventable, unlike cervical cancer that is preventable. And just seeing what my sister went through, what I also went through, it made me think about where I wanted to specialize. Being that I was in medical school at the time, I thought to set up an NGO, and then after interacting with many patients in the NGO, I realized that I wanted to become a cancer specialist because there were only 30 at the time. Now we have about 100 clinical oncologists in Nigeria, still very few, but at least I added to the numbers at that time. My goal really is for those cancers that are preventable, let's prevent them. For the ones that we can treat and cure, let's diagnose early so that we give women and men the best fighting chance. And in situations where we can't, treat or cure, at least everyone has dignity when they're going through whatever obstacles in life. So I'm motivated by helping people feel better and become more purposeful in their journey. And I truly believe that when people have cancer, they shouldn't lose focus on why they're on earth or why they exist.
Your journey has been impressive, and I'm super glad that you are a part of the Stop HPV for Her campaign. Now let's talk about HPV. How would you explain it and break it down in the simplest way people will understand what HPV is and their spot to take actions?
So when we talk about HPV, many people are like, what's that? I think a simple way I would explain this is HPV is a virus, it's a germ. But before I go into germs, normally you and I, we have germs in our body that actually makes us healthy. We have germs on our skin, we have germs in our mouth, and that's normal. But there are certain types of germs that are not nice, they are bad. And these germs can be bacteria, viruses, fungi, and so on and so forth. HPV is a virus that is transmitted during intimate sessions. And this virus, most times, people who have had intimate sessions have gotten it, and luckily our immune system is able to clear it away. It's just like someone having cough catarrh. Many of us have had cough and catarrh. For people who have had intimate sessions with their partners, they may have gotten the HPV virus, but most times the immune system clears it away. However, when this particular virus, this germ, stays on, then it's one of the characteristics of being a virus. Viruses know how to infect and then go away. So HPV is a germ that usually the immune system can clean out, and sometimes it has the power to stay within a woman's body.
So we've just established what HPV is. Talking about cervical cancer, what's the link between HPV and cervical cancer? How does the former lead to the latter?
Okay, so during intimate sessions, a woman may become infected with HPV. Now, her immune system is able to clear it within a few weeks, a few months. But in some instances, the HPV virus hides or escapes, evades the immune system. And so instead of that virus being cleared within a few weeks, few months, because it's hidden, it hides for years, decades, 10 to 15 years. What is characteristic about a virus? One thing about viruses is they enter normal cells, they change it, make it become abnormal, and those changes can become cancerous. So HPV has the characteristic of changing a normal, healthy, nice-looking cell to an unhealthy, cancerous cell. And so that's how HPV infection, if not cleared, that stays on the cervix for many years and many decades, can cause abnormal changes that lead to cancer if not detected early. So there's a very long timeline between infection and becoming cervical cancer.
Talking about that timeline between HPV and cervical cancer is preventable. Yeah. So when we talk about preventing HPV-related cancers, what are like the processes or procedures people should take to prevent cervical cancer?
So when we're thinking of prevention, think of two things. The first one is primary prevention and there's secondary prevention. Primary prevention is when you prevent yourself or someone from being exposed to the HPV virus in the first place. If you're not exposed to the HPV virus, you're not going to develop HPV infection that can lead to abnormal changes and lead to cancer. How do you prevent that? Primarily through vaccination, with the HPV vaccine, and abstinence. On the other hand, secondary prevention is when you've been exposed to the virus or to the risk factor, which is the HPV virus. How do you ensure that the fact that you've been exposed to it, you don't develop the complications of the presence of the virus? Through screening with pap smear is a perfect example. So yes, a woman may have had an intimate session, she's exposed to the virus. If there are any changes on the cervix, the pap smear will pick it up. And if we pick up those abnormal changes, we can treat it and prevent it from becoming full-blown cervical cancer. So primary prevention is at the very beginning. You prevent the risk from happening. And secondary prevention is there's a bit of exposure, but you stop the complication from starting.
Interesting. Let's talk about the age ranges when we should have the primary prevention and the secondary prevention. From what age to what age should people pay attention to primary prevention? And for those people who, okay, we didn't do the primary prevention and we are already exposed, from what age to what age should they have the secondary prevention?
So primary prevention starts from age 9, where girls can get vaccinated against the HPV and get HPV vaccination. It's as simple as that, starting from age 9. And the reason why this is important is because the girl has not been exposed to the HPV virus. And what has research and science told us over the years about vaccines, immunization, is that if you have not been exposed to the thing causing something, you will have better immunity against that thing. And so that's why we emphasize age 9. And when research was done many decades ago, they found that age 9 was like the perfect age to start a girl who has not been exposed to the virus. Now, for women who have been exposed to the virus via intimate sessions, you can start your pap smear screening from age 21 years old. And you can do that every 3 years. So you do your pap smear every 3 years from age 21. The second option is you do your pap smear and HPV DNA testing every 5 years. And this is the best way of screening. We call it the gold standard for prevention, where you do the pap smear to check if there are any abnormal changes caused by the virus. And you do the HPV DNA test that tells us if you have the virus or not.
Awesome. Talking about the vaccination, but is this vaccine just for girls or should boys be getting it as well?
Vaccine is for both boys and girls, and there are different brands in the market. Some vaccine brands are for girls only, some vaccine brands are for boys only. Now, in countries that have the resources, that invest heavily in their healthcare system, vaccination is available for both boys and girls. But in countries that have limited resources, they have to sit down and think, HPV, which gender is it affecting the most? Is it the boys or is it the girls? HPV is affecting more women because boys may get infected, but it doesn't cause as much issues or damage as it can in the female gender. And the most common issue we have with HPV is cervical cancer. And so that's why there's a lot of focus in limited resources, in countries that have limited resources, on let's focus on girls, because there are, 14,000 women are dying every year from cervical cancer.
Okay, still talking about vaccines. When it comes to vaccination, a lot of parents are always trying to be careful, and we are seeing a rise in anti-vaxxers in today's world, where people are kicking against vaccinations. Safety is always on their mind. How safe is the HPV vaccine? And what should mom and dad, parents generally know before making the decision to get their children vaccinated against HPV?
So now when it comes to the resistance to vaccination, this is nothing new. Every vaccination, is resisted. And there are always those group of people that don't believe in it, don't believe there's science to it, don't believe there's benefit to it. And whilst it's good to have people critiquing it, moms and dads have to make their decisions from a place of fact, not rumors, not myths, not they say, them say. If you take a look at countries that have been vaccinating for the past 2 decades, you will see one thing is for sure. Cervical cancer incidence has reduced significantly. And science continues to tell us that these women that got vaccinated 20 years ago are doing quite well now. There's nothing wrong with them. And I'm talking about more than 10,000 women that were originally vaccinated when they were 9 years old, 10 years old, and now they're in their 30s. And they're living healthy lives, having children. So where are we making our decisions from? Is it based on science or rumors? Now, remember that there are many people who have been vaccinated. If something has gone wrong, it will be in the newspaper headlines. And as an oncologist, from where I sit, I would rather not treat a cervical cancer patient because it doesn't make sense. It's preventable. No woman should have cervical cancer. It costs more to treat cancer. It costs less to prevent cancer. So HPV vaccination is generally safe for girls and for women.
I'm glad that you mentioned fertility, because since the Stop HPV for Her campaign started, we've heard a lot of myths about HPV. Some people say, oh, it's the same thing as HIV. If you get the vaccine, this is going to happen, that is going to happen. And I'm sure as an oncologist, you've heard a lot of stories and rumors about HPV and cervical cancer. What are the 3 biggest myths you've come across and you would like to debunk right now?
Okay, the 3 biggest myths about HPV that I will debunk. The first one is HPV vaccination causes infertility. That's not true. False. Because there's a lot of science and data that proves that that's not true. And we're talking about data of 10,000 women. And when we do research, we follow up women on a yearly basis to check, how are you doing? Do you have any side effects? How's your reproductive history? How many women who were vaccinated have children now? And we are not worried by the data we are seeing globally. Another myth is that the HPV vaccination is very expensive. That's false, because at least we have a group that is free for. That's girls from age 9 to 14 years old. HPV vaccination is free, especially if you go into the public hospitals. So it's not expensive. when we talk about young girls. And when you compare it to the risk of having cervical cancer, the cost of HPV vaccination for adults is nothing compared to the cost of developing cervical cancer and treating it, which runs into millions of naira.
I totally agree with you on that. So we know that getting the HPV vaccine can prevent cervical cancer. We also know that doing pap smears regularly, you mentioned every 3 years, can also prevent or detect cervical cancer pretty early. Apart from these two, are there any other checks or screenings women and men need to do to stay safe from HPV and cervical cancer?
So when it comes to medical checkup, adults should present once a year for their medical checkup and know your numbers, from knowing your BP to your cholesterol levels, to your blood sugar levels, to your weight, to your height, to your BMI. And then when you sit in front of a healthcare professional, they will tell you the appropriate tests you should do for your age. But a lot of times we like to look at the heart, the kidney, the liver, how all of that is functioning nicely. We also do certain screening tests. For women, we do things like pap smear from age 21. We do mammograms from age 40. A healthcare professional can check your breast from age 21 also. For men from age 40, we recommend the prostate-specific antigen test. For people above 45 years old, particularly in Nigeria, we recommend colonoscopy. And that's when we're checking the colon. So there are a lot of tests, but depending on your age and gender, and you sit in front of a doctor, they'll tell you the right tests or plan for you.
Thank you very much, Dr. Lola. You've shared a lot of, insights today. I have just one more question, but before I ask that, we've been talking a lot about getting tested, getting your pap smears. Where can people get tested? So let's say I live in Moshi, I live in Ikorodu, I live in Lekki. And I want to get tested tomorrow. What should I do? Where should I go?
So for your pap smears, the first thing is to know that 2 units in hospitals do this. The family medicine units, that's like the general practice, as well as the gynecology units, the women's clinic. So depending on the nearest hospital to you or the hospital you have access to, maybe you have health insurance. So you need to walk into the hospital or put a call through and ask the hospital closest to you or the one within your network of the day they do the pap smear screening or the day they do the HPV testing or vaccination, what services are available there. Book an appointment, and it's as simple as that.
One last myth. People say pap smears are very painful. Dr. Lola, do you want to say something about that?
Okay, it is not painful. It is just uncomfortable. Going for your pap smear, the first thing is not to have the mindset that it is painful. It is uncomfortable for many women. But the thing the nurse will do is actually to use the right size of speculum, the equipment we use. And there's the medium, small, large. So based on what the nurse assesses, she will use the right size. And then you have to be calm, because a lot of times women are tense, their muscles tense. And so it's a bit of a struggle for the nurse to conduct the pap smear. So just, yes, it may be uncomfortable, but take deep breaths, and in less than 5 minutes, about 5 minutes, the pap smear is over.
Finally, drawing from your years as an oncologist, what's that one key message you'd leave every parent and guardian with tonight or today?
I would like to see a Nigeria that has a generation free from cervical cancer. And for that to happen, we have to take action now. Our young girls have to become immune to the HPV virus by getting their vaccination now, so that when they're in their 20s, 30s, they don't get infected, and where 30, 40 years down the line, we have eliminated cervical cancer. It doesn't exist. It's no more the second most commonest cancer affecting our women. It's not accounting for 14,000 new cases. And for us to achieve that, it means we have taken action now. And so, with everything I have shared with you, I would like you to take action. Book your appointment, read up more on the BellaNaija Stop HPV for Her, and take action. Go get screened, get your pap smear done, talk to your doctor, and you may benefit from the HPV vaccination. And definitely take the young girls at home, in your school, in your religious network for HPV vaccination. Hi, I'm Dr. Omolola Salako. I'm the People's Oncologist. Follow the conversation on BellaNaija using the hashtag StopHPV for Her.